Hey guys, good afternoon. Fertility Talk on a Friday afternoon at 1. We used to do it a while ago and we stopped, but we're doing it again whenever we can. So, good afternoon. Hope you're all well. It is Friday afternoon, and today we are talking to Professor Siebert. He is from Aevitas Fertility Clinic, and they are out in Pinelands at the Vincent Pallotti Hospital, and we're just going to wait for Professor to come on. We are talking about adenomyosis. So it's a big word, and I honestly have no idea. I don't know anything about adenomyosis. I've actually recently found out about it. Um, so yeah, we will wait for Professor to come on board, and then I'll just send him an invite. We'll just wait for Aevitas to come on board, and then I'm sure he'll be joining us now, and we're going to be talking about adenomyosis. So adenomyosis is something close to endometriosis, I think so, or somehow it's related, but we're going to wait for Professor to explain everything about adenomyosis to us. And it's also to do with people, with those trying to conceive, that suffers from adenomyosis. If you guys have any subjects you'd like us to discuss, anything important related to fertility, and you'd like us to discuss it, please let me know. Please send a message, send me a DM me, and then we'll try and do that topic. Maybe you're dealing with something in particular and you want to get more information on it and how to deal with it, then please just send me a DM me, and then then we can discuss it. So I'm just gonna wait for Aevitas to come on board. I'm just trying to see if they if they're around, if they know that I'm around. It is confirmed for 1 today, so I'm sure Professor's just trying to get things sorted and get up. So we're going to, while I'm here, while we're busy talking, we're going to run a Okay, thanks very much, Kambosi. Is it Kamobi? Yeah. Thank you for that. Dr. Q did do quite a great job with that talk. Thanks, Rosanna. We're doing your topic. Yay. So I'm glad you joined us. We're just going to wait for Professor Siebert to come on board. If you guys have any questions regarding, if any of you are suffering from an adenomyosis and you have any questions, please let me know, because then I can definitely put it to Professor while we're on, if we have enough time. So I'm just going to wait for Professor to join us, or Aevitas to join us. They're not on board yet. Yeah, so the questions we have today is, for example, what is adenomyosis? How is it diagnosed and can it be treated? How does adenomyosis differ from endometriosis? Like I said earlier on, there's a like a collab between the two. And I don't know what that is, so we're going to wait for Professor to explain that to us. And then, can one person have both adenomyosis and endometriosis? And how does adenomyosis affect your fertility? And someone trying to conceive, and I think that's the big one, because at the end of the day, most of us are here because we are dealing with infertility issues, and these are the questions that we would like to get answered, because so the other one is, how does it affect your period, which is a good one as well. And then, what are the impact of adenomyosis on IVF treatments? Is there a way, is there something different you need to do when you're dealing with infertility and when you're dealing with IVF and you are suffering with adenomyosis? Is there anything else that you can do that's different to help you succeed with adenomyosis? So that is the questions we're going to ask him. I'm going to just double check to see if we've got the professor, if he's around yet. Thank you for this. I'm helping this for endometriosis as well. Thank you, Wanga. Thank you for joining us. So we're going to be talking, I think it's related to endometriosis. adenomyosis. And like I said, I know nothing about the subject. It's quite new to me, so I'm also very eager to hear what adenomyosis is all about, and understand adenomyosis a bit better. So I don't know what the problem is with regards to Professor or where he is, and we're just going to wait for him. Otherwise, I'm just going to go off and then come back on again in a few minutes, because we need to find out where the professor is. And I do understand they are doctors at the end of the day that also have patients to deal with, and anything can happen. So we have to give them that. And they do this out of the goodness of their heart to try and assist women in all aspects of fertility and give you as much information as they can to try and assist you. And they're doing it at just out of the goodness of their heart. So, yeah. Okay, there we go. The Aevitas has joined us, and now we're going to invite them. Okay. I think they've joined. Here we go. Hi, Professor.
Hi.
How are
I'm well, and yourself?
Good, thank you. I've been trying to keep everyone entertained while we waited for you.
We were online, so we were wondering when you were running late with all your good stories.
No, I was just about to break out into a dance here to keep everyone entertained. So thank you for joining us now. So we're talking about adenomyosis, and like I said, I've never spoken about this topic. I never even touched on this topic. I didn't even know it existed. I never knew it existed, basically.
Yes.
And it's come to me because somebody that's very close to me has actually told me that they suffer from adenomyosis. They've been going through fertility treatments, and they really just want more information on it. And as I started promoting it, I'm seeing quite a few women is asking about this. So it's clearly a big topic. And who better to talk about it than yourself? So yeah, thank you for that. If you could just start off by introducing yourself, of who you are and what clinic you're from, please.
Yeah, thank you very much, firstly, for the invitation and having this chat on a Friday afternoon. So I think it's a good topic to start off the weekend.
Yes.
I'm Igno Siebert. I'm one of the partners at the Aevitas Clinic in Pinelands. And as you know, we're a fertility clinic, but we are also a specialized clinic for complicated surgeries like endometriosis, complicated adenomyosis, etc.
Okay. So what we're going to start off with, what is adenomyosis?
Right. So it's actually people want to be very complicated in the definition, but it is endometriosis inside the muscle wall.
Yeah.
So if you could recall when we had the chat about endometriosis is when the lining of the uterus, what we call the endometrium, is growing on the outside. But with adenomyosis, the lining is growing in the muscle. So there are a couple of ways that it can happen. It can either infiltrate the uterus from the inside through a previous scar, like a cesarean section. So it infiltrates from the inside. It can infiltrate from the outside, which is normally associated with endometriosis. And there's also what we call a coelomic metaplasia situation where the cells just starts to undergrow like a cancer, and it starts to differentiate in a different type of cell. So then that's the way it can occur, but in short then, adenomyosis is when the cells of the lining of the uterus, the endometrium, grows in the muscle.
Okay. How is it diagnosed and how can it be treated?
Yeah, so a couple of things. So firstly, it's symptoms. So most probably your friend will suffer from heavy periods, meaning menorrhagia, heavy bleeding, painful bleeding, and then infertility. So if it is diffuse, meaning it's infiltrated throughout the muscle, that uterus is really a problematic uterus and can present with these symptoms. It can also be a little bit more focused. We call it lobular. And then it is exactly the same as a fibroid, the same symptoms. So adenomyosis is predominantly, firstly, the clinical symptoms. Then on ultrasound, there are today different signs of adenomyosis, and with a good ultrasound, you should be able to pick it up. And then obviously, then in surgery, the definitive diagnosis is a histological diagnosis, where you cut a part of the uterus away, send it off, and as with the fibroid, you will see the adenomyosis tissue.
Wow. Okay. How does adenomyosis differ from endometriosis? I think you touched on it now in the first question.
So
maybe go
again. It's good to ask the question again. So just to be very clear again, endo is when the endometrium, the lining, grows on the outside, and adenomyosis is when the lining, the endometrium, grows in the muscle.
Okay. Perfect. And then can one person have both adenomyosis and endometriosis?
Absolutely. So remember, I said there are three ways that our adenomyosis can develop. So the one is it grows from the inside, it infiltrates into the muscle. The other one is from the outside. And it's normally at the back of the uterus where the endometriosis is also situated, and it grows into the muscle. So posterior, in the pouch of Douglas, adenomyosis is normally associated with endometriosis.
Okay. How does adenomyosis affect your fertility if someone's trying to conceive?
Yeah, so again, then endometriosis, we have discussed, it can be associated with endometriosis. It's the inflammatory response. If the endometriosis can damage the tubes. But adenomyosis per se is creating a hostile environment for the embryo to implant. It can also cause contractility of the uterine muscle, which will stop the forward movement of the sperm towards the egg. So adenomyosis is very counterproductive from a fertility point of view. Sperm impact on the sperm transport as well as the embryo implantation.
Yeah. Okay. So how does it affect your period? I should have asked that first. How does it affect your period?
So as I said at the start, your diagnosis is made clinically, then via ultrasound, and then lastly is via histology when we do surgery. So as the adenomyosis, the endometrial cells infiltrate the muscle, that muscle will be then very painful when you menstruate. So it is painful periods and also heavy periods, because the uterus can become infiltrated and a big globular uterus, and then very difficult to contract during menstruations, causing heavy, painful periods.
Okay. What are the impact of adenomyosis on IVF treatment? With this, I know I've just put this one in very late because it's an email that I got from someone. But how does it impact your IVF treatment? And more of, could there be success with it? Or is it something that it's a long-term process when it comes to IVF and dealing with adenomyosis?
Yeah, so remember also I said adenomyosis can be diffuse, the whole uterus, diffusely enlarged, or it can be a focal, like a fibroid. So when adenomyosis is very close to the endometrial lining, it causes the production of growth factors, and it causes abnormal contractions of the uterus that when you implant your embryo, it will be rejected. So the adenomyosis causes a hostile environment for the embryo. But your next question will obviously then be how can we treat it? How can we improve it?
Yes.
So if we use medical treatment, like with endometriosis, and we stop ovulation, we can suppress the adenomyosis tissue inside the muscle. And classically, what we do is for 2 to 3 months, we suppress the adenomyosis and then we transfer the embryo. If you've got focal adenomyosis and it's very close to your endometrium and you've got failed IVF, 1 to 2 failed IVFs, then we will go and remove it the same way as what you remove a fibroid.
Okay. Okay, that's good to know that there is something that can be done about it. So in the end, you can have success with IVF.
One must be very clear, sorry about it, one must be very clear that adenomyosis can be very complicated, and specifically it infiltrates the whole muscle, because then you can't cut it out. If you cut it out, it's hysterectomy. So those patients are really problematic, and we give either the Zan or we give the injections, the 3-month injection, trying to suppress adenomyosis, but there are ways to treat it, yes.
Okay, thank you. That's great information. Thank you so much for your time and always just availing yourself for us. Thank you very much. So this is Professor Siebert from Aevitas Fertility Clinic. Professor, please tell everyone how they can get hold of you. Maybe just going to give you a website address or something, and they can contact you for those dealing with endometriosis or adenomyosis.
So we are at Vincent Bellotti in Pinelands. Our clinic name is Aevitas, Aevitas. So if you go onto our website, it's www.aevitas.co.za. And we would be gladly there to assist you in which way we can help.
Thank you very much. Thanks, Professor. Have a great weekend, and thanks again for availing yourself for us.
Thank you for you too. For the weekend. Bye-bye.
You too. Bye-bye.